Good evening, ladies and gentlemen. Welcome to the Pitt County Board of Health meeting. This time I'd like to call the meeting to order. First thing, we have public comments, and I don't believe nobody is here for public comments, so we'll move on. Second thing on our agenda is we have a special recognition. I'd like to come down and award this special recognition to Dr. Joan Wynn. There you go. Get you in a minute. This is a special recognition to Dr. Joan Wynn in appreciation of your service on the board as a member from 2002 to 2011, and we surely appreciate it. You've been a long friend, and we're going to miss you.
Thank you so much.
You're welcome.
I appreciate it very much. It was an honor to serve.
Thank you. The next thing on our agenda is the minutes from last month. Hope everybody's read them, and if there are any questions with them, I'd like to hear a motion to approve.
So moved.
Second. We have a motion to approve and second it. Any discussions? All in favor?
Aye.
Opposed? Minutes have passed. Next thing on the agenda is the financial report. John?
Thank you. Good evening. You have the April 30th financial report. Not a whole lot has changed from March 31 to April 30, but I will just make a few highlights. If you take into effect the timing differences, you're going to see a deficit on the lower right-hand corner for about $21,000. We're only 2 months away from the end of the fiscal year, so you would anticipate that I've been telling you all year long we're going to use up most of our fund balance budgeted. The $21,000 deficit would tend to make you think, well, maybe we're not going to use all of that fund balance. I just want to reiterate the fact that in June, the last day of June, we've got a payroll period that is really going to dramatically impact our cost structure. So I think we will, everything else being even, get closer to using all of our fund balance. One thing, just kind of going down the report, you'll see that in the timing column, I have put in the pro rata part of our budgeted Medicaid cost settlement. We have gotten a preliminary indication from the state on the Medicaid cost settlement. It is good news. The preliminary indication is we're going to exceed our budget and possibly by a significant amount. It's still preliminary, so I'm kind of holding it in my hip pocket a little bit. I think we have some good news there. The clinic fees and environmental health fees haven't changed much. They're still a little under budget from what we had thought they were going to be. We're getting into warm weather, so we're hoping that May and June will close that gap on the environmental health fees. Clinic fees, I don't think we're going to close that gap. I think that's that $13,000 variance we have in the far right column is probably going to stick through the end of the year. The Medicaid revenue, you'll see there is about an $86,000 negative variance. Some of that is timing, and some of that is due to we are going through a new system on how we bill Medicaid for our prenatal services. We're going from a billing by individual service to a global billing, and this is after the client has the baby. We bill all of the services. So some of that Medicaid revenue that may be short this year because of the way the pregnancies fall, we may actually pick that up next year. I'm hoping any deficiency we have in our straight Medicaid revenue will be offset, and hopefully more than offset, by the bringing in additional Medicaid cost settlement funding. Other than that, I think we're, moving right along. I don't see any surprises in this budget, so I'll be glad to answer, Mr. Chairman, any questions the board may have.
Do we have any questions? All in favor to?
I'd just comment, just to clarify, John, for the public, I think you mentioned that big payroll at the end of the year. Just to remind people that this year was one of those strange years that comes around every 11 or 12 years.
Every 11 years.
A 27th payroll in the county, and that's why that's impacting us so much. If y'all recall, our expenditures, about 86% of what we spend in our budget is personnel. And so our biggest cost is payroll, and we've got a 27th payroll this year that's really had a big impact on our budget.
I need a motion to approve.
So moved.
Second.
I have a motion to approve and second it. Any other questions? All in favor?
Aye.
Opposed? Thank you.
Mr. Chair, I do have a couple
go
more
ahead.
items. One is I wanted to bring up to date on our early retirement package. As you're aware, the county developed an early retirement incentive for employees. 5 of the health department employees have accepted the early retirement package. That's 4 nurses, 1 administrative support person. We calculated it, and with those 5 individuals leaving, we're losing about 98 years of experience at the health department. It's almost 100 years of experience. That's a lot of knowledge that's walking out the door. In the recommended budget that we have given the county manager, 2 of those early retirement positions are not budgeted to be replaced. So that will impact services going forward. But I did want to just reiterate that almost 100 years of experience in those early retirements are leaving the health department.
How long for the early retirement? Can they still put in for it? Or is this?
To accept it,
Yes.
that time has come and gone.
It has come and gone?
It has come and gone. So these 5.
Okay.
They actually, 2 of them have, and because of the timing, 2 of these employees have until Friday of this week, I think, to say, I'm going to not do that.
Right.
But all indications are all 5 of them are going to do that. And then the final thing I'd like to just touch on is where we are in the budget process countywide. May 21st, the county manager will present to the Board of County Commissioners his balanced overview of the budget. That's on a Monday. The rest of that week is reserved for budget workshops, and those budget workshops will be here in this room. Dr. Morrow is scheduled to present the Health Department's budget at 11:15 on Tuesday, which is May the 22nd. If needed, the following week has been reserved for additional budget workshops, but only if needed. The tentative date for adopting the budget will be June the 12th at a 7 p.m. meeting here in this auditorium, and that will be the public hearing. If history repeats itself as it's done the last several years, that will be when the budget is adopted following the public hearing. However, if the public hearing results in some changes or modifications to the budget, June 18 will be then the alternative date for the commissioners at their regular meeting, which is a 6 p.m. meeting, to adopt the budget. So that's really where we are. Dr. Morrow and I met with County Manager 2 weeks ago just to go over the final recommendation that he has for our budget. So, and that was what was presented to the Board of Health at last month's meeting.
Anything
That's all I
else?
have, Mr. Chairman. Thank you.
Okay. Next items, we have some new business, a staffing update. Dr. Morrow?
Yeah, thank you, Mr. Chairman. As John just mentioned, the early retirement, these are in response to the incentive program that the county laid out for early retirement. And in addition to that, though, we have 3 other nurses resigning this month for various reasons. The Health Education Division has lost 2 staff recently. and has 2 more resignations coming this summer, and 1 on maternity leave right now. So they've been very stretched. The WIC Nutrition Division is down 2 staff in the breastfeeding peer counselors. We had a resignation from laboratory manager in April. Again, moving to another area, and we have 2 other lab tech positions that are vacant currently. In the administration division, we just received a resignation from one of our interpreters. So as you can see, the jobs are turning over, people retiring, and people leaving for one reason or another.
How many nurses in all between the retirement are you losing?
3 and, how many did you say, John?
4.
2. So 5 total.
I'm sorry, 4.
4.
So
So that's 7 total. That's right.
That's right.
Yeah, sure is. So I'm pleased to say environmental health is stable right now. So I think that's the one division we hadn't had turnover in. So between the budget issues and just staff turnover, we're going to have a very stressful summer, I think. And I think that leads pretty well into our next topic, Mr. Chairman, which was the conversation we had last month about our budget going into next year. In response to y'all's motion last month, I've drafted a letter that y'all have a copy of, and I think Dr. Hayes had input into this and has reviewed it. I don't know if you have any comments, Dr. Hayes, in terms of...
I reviewed this letter, and I think that it pretty much clearly states my feelings last month, that the budgetary cuts are going to have some significant effects on our ability to provide services if they continue. And so I felt like you addressed that well in this letter.
So we need a motion, Mr. Chairman, to...
Yes. I take it everybody's read the letter. Is any comments on it before your motion? Need a motion in favor of this letter going to the county commissioners?
I move that we
Second.
send this letter forward.
We got a motion and we got seconded. Any further discussions? All in favor?
Aye.
All opposed? Okay.
Yeah, thank you. I would just add, Mr. Chairman, that we are very busily trying to meet with staff and figure out how we're going to do the work more efficiently. We're looking at everything we can in terms of how we can design our work in a more efficient way. We've always done that, but particularly with these staff leaving, we're having to become extremely creative, I think, in terms of how we can do things. But we are already looking at services that we've got to cut back on, either in appointments, the number of appointments, or the actual availability of the service itself. So we haven't made any decisions yet to eliminate anything, but we are discussing it. So the budget is critical to that effort, as is staffing.
Dr. Morrow, I guess one question would be whether to use some of this attrition. You don't want to go below a level that you don't feel like are providing adequate services, but some of this retirements and attrition by itself help, I guess, in some regard.
It could, if we find those more efficient ways to satisfy the demand for the services that we offer. And I think that the other problem that we're running into, as John mentioned, with the experience, having almost 100 years of public health experience, and not being able to fill those positions is going to be stressful, I think. But we're going to do the best with what we get. So.
Dr. Morrow, is there a plan to
try to transfer some of the knowledge that these 5 people are leaving with to new staff or to current staff?
Yeah, I think particularly in some of the critical positions, we hope that we may be able to either bring someone in before they leave. Some of them are not retiring until later this summer or even early fall. So hopes is we can either train staff that we presently have, or once the new budget arrives in July, we hope we may be able to fill some positions that we could bring in and get trained before they leave. And then the other option may be to, once they've left, they have to wait 30 days, I think, without work, but we may be able to bring them back at least on a part-time basis to help us get those new staff trained, or existing staff, depending on what we end up with.
Thank you.
Thank you. Next item on the agenda is Community Transformation Grant. You going to take that, or?
I will introduce it, and Joe Morgan's also here.
Oh, okay.
She's heading up that grant effort for us, so I'll let her jump in wherever is needed, I guess. Just to remind folks, this is Community Transformation Grant is a CDC grant, a federal grant funded through the CDC, and funding is passed to North Carolina. The award recipient, or the grant award recipient, is actually the state of North Carolina. So it includes 98 counties. It did not include Wake County and Mecklenburg County, the 2 most populous counties in the state, but all other 98 counties were included. And then it was split up into regions according to the health director regions, and our region consists of 9 counties, and those are Craven, Pamlico, Lenoir, Wayne, Greene, Beaufort, Jones, Carteret, and Pitt. And Pitt County was selected by the health directors in those 8 counties, I should say, to take the lead on this grant project for the region. And we've done that, and thank goodness Joe Morgan has been willing to pick that up. As you know, we had the Communities Putting Prevention to Work grant for the last almost 2 years from the CDC, one of 2 counties in the state to have that grant. And so it's really a very similar in that this grant is addressing policy, environmental, and system changes around physical activity, nutrition, and tobacco, similar to what the Communities Putting Prevention to Work grant. So we've had some practice, if you will, getting ready for this Community Transformation Grant. We've met with the health directors from the other 8 counties several times, and are contracting with a facilitator as required by the grant. We're advertising and recruiting for staff also for this grant right now, and hope to have somebody hired. Those staff will likely, some of them will be based here, some of them will probably be based in those other counties. We'll also need an additional at least part-time fiscal person to assist with the contracts. There'll be a lot of contracts associated with this grant. I didn't tell you how much it was. It's $429,000 over the 9 counties for 5 years. So it's quite a bit of money. The County Commission, as you probably read in the paper this morning, yesterday, passed a no smoking policy for county buildings and vehicles. I think they should be applauded for that action. And this grant was mentioned yesterday in that it will help pay for the signage for the county no smoking policy. And we're doing also similar signage with parks in Carteret County. So those are some of the things that it does. Many of y'all have seen the Take Step 2 ad campaign. That's part of the Communities Putting Prevention to Work grant. So this ties in real well with that campaign as well. But we're trying to get the policy changes, like no smoking policies, enacted in all 9 counties. Along with nutrition and things like safe routes to schools for bicyclers and walkers, to get people walking more, eating better foods, and smoking less. or not smoking at all if we can do it. So we're real excited about this opportunity. Again, it's federal dollars. There's still some concern about what will happen should healthcare reform get turned around, as this is funded through the Affordable Care Act, is my understanding from the federal level. So we may know more about that by next month. The federal Supreme Court is due to give a decision on the healthcare reform sometime in June. So it could have a major impact on this grant as well as our Communities Putting Prevention to Work grant.
Thank you. Thank you for the update. Next on our agenda is Jim, support for Regional Environmental Well Program.
Good evening, Chairman and
Good evening.
members. I hope that you have in your package a copy of the letter that was drafted to Representative Bill Cook.
We do. We've got it.
This is in support of the Regional Well Specialist Program. Earlier this year, Wilson Mize, or last year, spoke to the board in support of local well rules, and I think that reaffirmed your commitment to protecting a very valuable resource. The North Carolina Supervisors Association and many of the counties have already furnished letters to the representatives and to the state for support for this program. Hopefully you'll remember that this was funded for 1 year by an extension of the budget through the North Carolina Well Drillers Association. We have some input from the state that says they're going to try to reintroduce the budgeting at the adoption of the new budget for these 3 positions. We've got 3 positions statewide, and they do provide a valuable resource in terms of acting between the counties and the individuals if there is an issue with interpretation of the rules. Now, these fall back to the state rules in addition to our local rules. They also supply a valuable resource in terms of equipment. They have thousands of dollars worth of camera and equipment, and they can come to Pitt County and provide in-well camera activity to find out if there's a problem with the aquifer or the construction of the well, and that's at no charge to Pitt County. We're in hopes in environmental health and in conjunction with public health that this letter is approved by the board and sent to Representative Cook. With the adoption of those well rules, you've already demonstrated your support for this valuable resource, and we hope it will continue with the signing and submission of this letter.
Actually, the letter, Jim, will go to all the representatives for Pitt
okay.
County. So we just got a sample here for Representative Cook, but it'll go to all the legislators from Pitt County.
Great, fantastic. So that is our request, and they're spread pretty thin, but they do, I think you've experienced that it is a resource for us that we can take advantage of. And if that resource is not available, we can still operate, but it encumbers us as far as working efficiently because these same specialists authorize us in Pitt County, as they do in other counties, to act as agents of the state. So in terms of enforcement, that's where we get the legal authority to act as agents of the state, is through those regional specialists. So I would hope that we can approve and sign this letter and send it on.
Jim, I'm just trying to remember, are there 2 or 3 of these well specialists in the state?
There are 3. The original program, as it was set up under Diener, and it fell apart with the reorganization of state government, and it didn't make the transfer to DHHS. Originally, there was a manager or a supervisor of the program, and there were 3 regional well specialists that were spread throughout North Carolina. The new budget calls for just those 3 positions, which the expected expenditure is about $250,000. It does not include the management component, and we are not responsible, or do we directly fund any portion of that. That comes directly through the DHS, or would come through the DHHS budget.
And one of these positions, as I recall, in the last session, got sort of saved by the Well Drillers Association, is that
Yes,
right?
sir. In fact,
They
all three.
volunteered to help pay for it.
Correct. All three of the positions were saved, were given a one-year extension by the North Carolina Well Drillers Association, who agreed to fund them for another year. With that reorganization structure, they were not a component of public health or DENR. So that's an unusual, to say the least, method of budgeting.
So that funding will disappear, as I understand this, come July.
Yes,
So
sir.
that's the reason we need
Yes,
support
sir.
for this now.
The well
hopefully
driller-
get, I think, through special appropriation
Yes, sir.
in the
North-
short session that starts next week.
But it's not just for our county, it's for every
Oh, no,
county in the
it's for the whole
state.
state.
Right, correct.
Yeah.
Yes, sir. And that will dissolve, that one-year extension was granted by the North Carolina Well Drillers Association, which is a very unusual move.
Any further discussions,
Any questions?
questions? Need a motion to approve and send this
moved.
letter?
Second.
I have a motion and seconded. All in favor? Opposed? Motion passed. The last item on our report is Health Director's report or update.
Okay, thank you, Mr. Chairman. Just in relation to what we were just talking about, the General Assembly is coming back into session next week, and I'm, as President-elect of the Health Directors Association this year, I'm also Chair of the Policy Committee, so I've been meeting with legislators on public health items likely to come up in this month's session. I just was in Raleigh actually this afternoon. And some of the things that I wanted to make y'all aware of, one, the aid to county funding for public health. There's some discussion as to whether or not that may be cut this year. It was also discussed in the last session, but was saved. And from my meeting today, it sounds like it's not likely to get cut, but that's about $11 million of state funding that supports local health department efforts. And if it does get cut, the real concern is that funding would fall back, I think, on the counties. So, and I hope that the legislators, I think, have a clear understanding of that. So, hopefully, that will be safe for at least going into next year. The other one I think that's we've talked about before is the food and lodging inspection fees. Trying to get the ability of local or more local control from boards of health and county commissioners to set the food and lodging inspection fees. Unlike all the other work that Jim's division does, that's the only fee that's controlled by the state and not by the local county. They tried to get an increase in that last year and had support from the Restaurant Association to do that. It got pretty confused last year, and what ended up happening was they did not increase the fee significantly. They did increase it slightly from $50 to $75, but at the same time they decreased the percentage of money that went to the state and went from about $25 going to the state and decrease that down to about $7.50 going to the state. So now we're in a pickle because if the state doesn't have enough funding come July, when this decrease would take effect, they're not going to be able to provide the support that they do in terms of processing all those fees for across the whole state. So we've been talking to the legislators about either getting back to increasing the fee in this short session coming up, or at least postponing that decrease in the percentage that goes to the state come July. And I'm not sure which of those will happen, but hopefully one or the other will happen. And the last one I'll mention is the consolidation bill that we've discussed that would give counties the option of putting social services and public health together. This is an issue, I think, that came from some other counties in the state, and Pitt County does not have any interest in this, according to county manager and others here, but there are some counties across the state that are very interested in this. Particularly other boards of health and boards of social services around the state are very concerned because the language that's presently in that bill, which is in the House right now, could eliminate both boards of health and boards of social services in some of those counties. And there's a lot of concern about what that would mean in terms of representation and making sure that good decisions are made for the purpose of public health. As the bill is written right now, it also includes consolidation of mental health services, which really doesn't make sense since those are under control of local management entities now. And it also includes the option of regionalization. So it's a very confusing bill to look at right now, and what we hope to do, we think the bill has enough support to get passed in this session, but we are trying to work with the legislators to make sure the language gets cleaned up in a way so the bill is a good law when it does pass. So I'll be glad to answer any questions about those, but just wanted to update you on what's likely to happen. From all indications, it sounds like it's going to be a pretty quick session when they come in next week, but I don't know, so we'll just have to wait and see.
So is this all a money-saving issue that they're trying to?
The consolidation?
Yeah.
It's partly that, I think. This is an item that's on the County Commissioners Association legislative goals. I think it initially started in response to some counties where they had problems either with their board or with directors of agencies, either social services or public health. As I understand it, most of those problems got resolved, and the bill in its present form, I'm not sure would even fix those problems. But the other thing is, there's been discussion that there could be some savings from consolidation. I think that needs to be studied more. When you look at the counties in the state that are consolidated right now, it's really Mecklenburg and Wake counties. Mecklenburg's got as I understand, has a very large discussion going on between the hospital and the county. I think somebody's suing somebody over what's been done down there right now. And Wake County, they do have a consolidated human services board. However, the way I understand that operates, they have a public health committee and a social services committee, and they've appointed a health director, so I'm not sure exactly how they've saved money in that structure. There are some studies going on. I think UNC is about to release a study now, I think, looking at public health structure. I don't think they're going to show that there's much difference in terms of improved health status depending on the different structures that are available. I think North Carolina has still one of the best public health systems in the country. We've got one of the oldest systems. A lot of other states envy our system. I know personal people I know that have come here to work from other states as health directors because of our good system and our reputation. Our boards of health are 100 years old this year, and I think the boards of health system has proven that it works very effectively, and having professionals like yourselves to give input on the decisions that affect the public's health, I think is critical. So, but it is all about money in the end, I think, yes.
Will it have a significant impact on the clinic and services? Is that,
I don't think so, no, and that's not happened in Mecklenburg or Wake counties. It's really more about the budgets and who pays for what, and who does somebody work for is what's going on, I think, in Mecklenburg County. So it's a lot of personnel and administrative issues mostly. But we're certainly, in favor of anything, and I certainly wouldn't sit here and say that public health is perfect, and I think we definitely need to change, and we need to change in a positive way, and I'm just not convinced that this legislation is going to get us any closer to improving public health.
Dr. Morrow, since the boards are volunteer
Yeah.
boards, I'm having trouble understanding how having, I guess, a super board would save money.
Well, I don't either. I mean, when you look at the construction or the makeup of the Combined Human Services Board or Consolidated Human Services Board as outlined in this legislation, it's a huge board. It's at least 20 people, I think. So I think it's going to be difficult. As you know, when the boards get that big, it's hard to get things done. So, but I think Wake County has had some experience with it, and I think it would be good to hear from Wake County board members to see how they think it's worked. Folks that were, say, on their Board of Health before and now have experienced with the Combined Human Services Board, how they think it's benefited or hurt public health. I think that would be good to hear. I'm not sure we're going to have the opportunity for those conversations before this bill gets passed, though.
Is that it? Any other?
I did also want to just update you on what's going on with the smoking bar situation. We're still receiving complaints on smoking bars in the county. Our county attorney has spoke again with the attorneys for the 4 bars that had appealed our decision, the board's decision, to the State Court of Appeals. And their attorney has filed a petition for discretionary review with the State Supreme Court. We are awaiting that decision. It should not be, from all indications I'm getting, it should not be that long before the State Supreme Court makes their decision on whether or not they'll hear the case. They did not hear the case that was appealed by Guilford County, and so I think it's fair to assume that they'll probably act in a like fashion in this case. But we will, once that decision is made, we still will need to consult further with our attorney on the assessment of fines, and those fines that are assessed on those 4 bars will go to the Pitt County Public Schools. So we'll have to settle out on those fines eventually. That's all I have, Mr. Chairman.
Any further questions or comments? And then I need a motion to adjourn.
so moved.
Anybody second?
Second.
All in favor?
Aye.
Opposed? No. Thank you.